Now, in other news, Prime Minister Yair Lapid getting the flu vaccine as well as yet another coronavirus vaccine ahead of the winter. And Lapid publishing the images in a call to all citizens of Israel, especially those in at-risk populations, to follow suit. But is this a friendly reminder or an ominous warning? To discuss, I'm joined by Director of the School of Public Health at Ben Gurion University, Professor Nadav Davidovitch. Professor, it's great to have you back with us. Now, I'm sure that I've asked this before, but how many more COVID vaccines are we going to need, and how often should we be getting them?
So, first of all, I always prefer friendly reminders and not panicking. Many other infectious diseases, we get lots of boosters. By the way, including polio right now, there is circulating vaccine-derived polio, and people also got the boosters. Probably what's going to happen, similar to influenza, that we're going to get every year an adapted version. I really recommend, especially for high-risk people, to go and be vaccinated. There is a sharp rise now in cases. We see it in the sewage wastewater sampling. And we need to remember that vaccines saved about 20,000 lives just in Israel. But vaccines are not enough. There are many things we can do. And there's not only COVID. We have influenza. We have strep A now. Also in Israel, we have lots of upper respiratory infections. So hygiene, not going sick to work, not sending your child sick to school, all of the things that we know. And on the national level, strengthening the healthcare system, strengthening hospitals and community healthcare, because always during the winter, we have the same situation that we need to have, unfortunately, in the corridor, some of the patients, and that's definitely not a good sign.
All right, well, Israel had a really high compliance rate, arguably, with coronavirus vaccinations, but how has that high level sustained, or are Israelis maybe just not as concerned as they should be anymore?
So we started with a beautiful, amazing vaccination campaign. It's hard to believe, but it happened just 2 years ago. By the end of December, I was vaccinated at Soroka Medical Center. It's a Ben Gurion University hospital. But after a few months, unfortunately, things started to become much harder. We need to do much better, especially vaccinating young adults and children. It's also very efficient there. And there are parts of the reason why we continue to see the spread. We need to have a vaccination law, not to enforce, but to have enough resources, enough people that are doing health promotion, not just on a national level, but working with communities, working with community leaders, with rabbis, with other religious leaders. And I'm I want to stress the importance of having vaccines, not just of COVID, but other diseases as well. We mentioned influenza, but also polio right now. And we're doing now a study at Ben Gurion University with the Minister of Health about vaccination rates for other diseases, those in the regular schedule that unfortunately we didn't push enough in the last 2 years. And that's something we need to remember. There is vaccine hesitancy, unfortunately, because of infodemics. There is lots of fatigue because of COVID. But vaccines are really efficient and safe and important. There is a socioeconomic gradient. People that are from low socioeconomic groups are less vaccinated for COVID, and that's something we need to address. So not just universal messages, but also targeting specific groups.
All right, Nadav Davidovitch, you mentioned, of course, to have a law backing this infrastructure for coronavirus vaccines, and of course the campaign not to legislate it. So hopefully, I think with that, we can say that nobody is hoping for another lockdown, nor do we think that that's a realistic scenario at this point, thankfully. Professor Davidovitch, thank you again so much.
We are not going there, and the zero cases policy of China and other countries is totally unattainable, and also the cost benefit is really poor.
Sure.
So yes, living with COVID, but doing the right things, as we mentioned.
Nadav Davidovitch, thank you so much.
Thank you.